All right, good morning, good afternoon, good evening, depending on when and where you're watching this live. This is the voice of Dr. Tolulope Olabintan, CEO and co-founder, Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. And today we're having a conversation on the topic. Doc, my DEXA scan says I have osteoporosis. What does that mean? Um, and we're going to be having a guest. I'm not sure where she is right now, but she should be joining us shortly. And we'll be having Dr. Panico, Dr. Brittany Panico, talk to us about this topic. And so for you, if you're watching live, hashtag live, you're watching a replay, hashtag replay. How are you doing? Comment in the post. Um, and let me know where you're watching from if you're live, and we'll go from there. All right. Now, some of you may be wondering why we're having this topic. Well, a bone scan or a DEXA scan is one of the scans we do to check for something called osteoporosis. So the whole idea is to find out if the bone is too thin, and if someone has osteoporosis, and preventing some of the consequences that can happen with it, such as a fracture. But we'll talk more. We have our guest. She's in the background. So please tag your friends for those who are watching live, and share if you're watching this on replay. Okay. Hi, Doc. How are you? Oh, I can't hear you. Can you hear me? You're mute. Oh, I can't hear you. Now try it without your headphones. Can you hear me? Let me see if I can hear you. No, I still can't hear you. All right. So while we wait for our guest to figure out her technical issues, we'll go ahead with the live. And so today we're talking about osteoporosis. What's osteoporosis? Osteoporosis is essentially when the bone gets really, really thin to the point where a mild injury or a mild fall could actually result in the bone fracturing, and that's actually the issue we're trying to prevent. All right, let's try this again, okay? All right.
Hello.
There we go. Yeah. All right. Awesome. So I would just explain to our guests what osteoporosis is. But what we're going to do is I'm going to have you kindly introduce yourself, who you are, what you do, and why you do what you do.
Yes. Good morning. So I'm Dr. Brittany Panico. I'm a rheumatologist in the Phoenix, Arizona area. And I'm hearing an echo, sorry. So I treat autoimmune conditions, osteoporosis, gout,
Okay.
and have a practice that specializes in the treatment of those things.
Okay. Awesome. And why do you do what you do?
I love rheumatology because it's a field that patients, I feel like, need a little bit extra time when they come to visits and delve really into like the diagnosis and treatment aspect. So I love spending that extra time with my patients. I think helping them realize that there is help, that despite having a diagnosis of something that seems, like a big thing, that we really can get you on track and feeling well with the right treatment and approach. So I think it's a really exciting field to be involved in. There's a lot of change happening, a lot of new advances coming out all the time, and just really awesome ways of helping people get better and feeling better.
Awesome. Now, for those who are watching, I just want to give a little bit more background information on Dr. Brittany. So she's board certified in internal medicine and adult rheumatology, and she takes care of patients inpatient and outpatient. She's very passionate about treating gout, rheumatoid arthritis, and psoriatic arthritis. She is the Chief of Rheumatology at Summit Rheumatology, which was awarded as the Gout Center of Excellence, and she was voted one of Phoenix Magazine's top docs in 2022. So I want to humble brag on you.
Yes, thank you.
All right. So my next question to you is this: what is osteoporosis, and why should we care?
So I think you kind of talked a little bit before I joined, but osteoporosis is when our bones start to become thin, and there's a cutoff range in how we come to that term. So
Okay.
osteopenia is the precursor. So your bones are heading towards the thinning phase. And then osteoporosis is once we've already figured out that they're thin. And we can do that from a DEXA scan or a bone densitometry scan. And ultimately, what osteoporosis means is that your bones don't have as much of a structure on the inside to bear weight of force that a non-osteoporotic or non-thin bone would be able to. So we typically measure these in long bones, like the thigh bone and then the spine. Those are more common areas to start to thin. And osteoporosis is much more common in women after menopause because as we advance past having our menstrual cycles,
Right.
estrogen no longer helps keep our bones strong and thicker. Osteoporosis is also possible in men, and some of the factors that can lead to that are things like low testosterone or previous injuries. And then also for people who are on certain types of medications can be at risk. So if you're on a long-term steroid course over the course of your adult lifetime,
Right.
you may be more at risk. Or if you're wheelchair bound, you may be more at risk because you're not bearing weight on those bones.
So the second part of the question was, why should we care? Okay, it's thin. Okay.
Yeah, so why should we care? Well, fractures as we age are one of the biggest risks of long-term complications. Maybe, living in a nursing home, if you break your hip, you're no longer able to be independent
Right.
at home. And then also, the more thin your bones become, just the more risk you are that simple injuries can lead to, again, a broken bone. Then when the surgeon goes to fix that bone or fix a broken hip, it's harder to repair because there isn't a structure to hold the hardware in place. So it's twofold. We should care because we want to be independent as long as
Right.
possible. And then we should care because of the way that our bones heal if they are repaired.
Okay, very important. And one of the things I always like to highlight with my clients is that if you were to have a fracture, the complications from being in the hospital from that fracture, including a blood clot, a lot of people, a good number of people don't leave the hospital the same way they came in. They actually leave much
Exactly.
worse. So we want to avoid you getting to that point. So prevention is very, very, very important. So next question, we already talked about how to test for it a little bit, but just for emphasis sake, how do you test for it, and when should we get tested?
So testing for bone density is very easy. It's basically done through a machine that you sort of lay in. It's kind of like a tanning bed. And you basically just lay, there's zero effort on your part aside from getting into the machine.
Right.
And then it just takes a very quick scan, and it doesn't involve radiation. It's more of the density collected of our bones. So it's very easy, very low risk. And it's typically done after 65, so 65 and older for women. It can be done before that if you have more risk factors.
Right.
So if you're somebody, again, on certain types of medications or who have certain conditions, or let's say you're maybe 55 and went through menopause very early, either artificial menopause or surgical menopause, you would be eligible to be tested earlier. And then also if you're somebody who continues to fracture bones, so let's say you break an ankle and it's something very simple, it's not a big fall or an accident that seems reasonable to break that bone, then you can be tested. But typically it starts after menopause, and then every 2 years, ideally you should be retested to follow the progression of those scans. And one of the key things that as rheumatologists we talk about a lot is trying to have your study done on the same machine if possible. So same location, same machine, because it's calibrated to be read equally. So If you're somebody who bounces back and forth from different locations, different, radiology centers, it can be a little bit difficult to track that over time.
Okay.
So much like how, we do mammograms every year on a schedule, bone density tests are done every 2 years. Ideally, at the same place is helpful.
Awesome. Awesome. So trying to do it at the same place is good for better accuracy too.
Yes.
Now, Doc, I have some men watching like, hey, we break our bones too. How come we're not included in this? What would you say to that?
So men are included, and it's one of the things that I'm trying to make a stronger effort in my community to build awareness about. Men should be included in this as well. It's a little bit more challenging from an insurance perspective, just because it's not as mainstream, although Medicare does cover bone density tests for men. So if you are a male and have been either repeatedly fracturing bones, or let's say you have a compression fracture or a fracture in your spine, that would be somebody that we would definitely want to test. And then again, being, wheelchair bound or more, bedridden patients, although it seems that would make it harder to test for, but those are the types of people that we definitely want to start testing. And men are eligible for treatment as well. So there's, we need more awareness in the community that men should be tested. And again, the reason for that is that we don't feel when our bones get thin. We have no idea it's happening until we break a bone and somebody tells us that bone looks thin. So to maintain independence, to, keep yourself healthy and being active and doing all the things you want to do, it is important to be tested. And if you're not sure if you should be, ask your healthcare provider, ask your doctor or physician, is this something that would be right for me given, my circumstances?
Awesome. Awesome. Of course, these are medical suggestions. As she said, important to make an appointment for a customized care plan for you.
Exactly.
A lot of useful information, Doc. Thank you. Next question. How do you prevent it? Someone's watching like, okay, this is important. I want my bones strong and thick like they should be. How do we prevent osteoporosis?
I'm so glad you asked that. So a lot of prevention starts early. So if, anybody watching this, if you're still having menstrual cycles, if you're, a male, female, within your 30s, 40s, 50s, really preventing osteoporosis starts when we're younger, because that's when our bones are remodeling and developing the most strength. So calcium containing food products, you don't have to be a dairy drinker, eater, but things that are high in calcium, like green leafy vegetables and broccoli, things like that, are really important. If you're a woman who breastfeeds, you have children and you breastfeed, it's really important to add that calcium back into your body, because making breast milk takes calcium away from you. So little things like that, when we're not thinking about bone health, is so important, because a lot of what we don't understand completely is how the bones age over time, and it really starts when we're younger. Another thing is vitamin D. So I think, across the nation, no matter where you live, sunshine, no sunshine, we tend to be vitamin D deficient. And vitamin D is one of the biggest building blocks for bone health. So vitamin D and calcium together build our bone strength. So making sure that you're, not severely deficient in vitamin D is also really important in helping to prevent osteoporosis. The other thing is weight-bearing exercise. So it doesn't have to be, you don't have to be a bodybuilder to do this. Even wrist weights, ankle weights, if you're just doing your normal, grocery shopping, strap on 1 or 2 pounds of ankle weights and use those when you go walking. That over time, that added extra weight can help you build bone strength. And it's not body weight. It's not the weight that you carry every day. It's additional weight periodically here and there. And then, of course, if you're doing a strength training routine, all of that is helpful. So those are the main ways to prevent, but I would say, you know, a lot of it is focusing on getting a good nutritious diet, especially, you know, starting that early. The earlier the better.
Awesome, awesome, awesome. And I like how it's like every conversation I have on this platform also leads back to exercise and eating well. It's amazing. Some of you were watching, like, oh, really? Veggies have calcium? Yes, they do. Exercises can help prevent and even treat osteoporosis? Yes, it can.
Yes.
And so be encouraged. Those little things, the little habits, the exercise, it adds up. You may not see it like the day after, but years after, your body would thank you. So I hope our viewers are encouraged. Very good. Thank you, Doc. Next question. And I have someone say, okay, fine, I'm in my 60s, I can't go back in time, and the diagnosis is here. Can it be reversed? Are there things to treat it, Doc? What are my options? What would you say to that?
Yes. So the answer is yes. You can actually work yourself back into building bone strength. Primarily, again, it goes back to that calcium and vitamin D intake. So if you're deficient in vitamin D, rebuilding those levels are helpful. And then the exercise routine. So if you're somebody who's right on the verge, let's say you have, a negative 2.5 on your bone density test. That's the cutoff range that we use. So if you're right at that cutoff, you can improve with nutrition and exercise. And just be diligent about it. You have to make that a goal and work on it, just like how you would treat diabetes by, working on your diet and exercise. And then if you're a little bit more advanced, so if somebody recommends treatment, either an oral medication called a bisphosphonate or something like Prolia that's an injection, or there's also daily injections if you're more severe in that category. So those are the main ways of treating osteoporosis, and they help rebuild that bone strength by adding, again, more structure to your bones, help rebuilding those bones. And that they work a little bit differently in the process of how our bones build and then reabsorb. So it's just finding the one that fits your unique situation.
Awesome. I love this. So there's a preventive part. There is the screening part. So going for your checkups to find out if that's something that you have. And then there's a treatment part, all in the hopes of helping improve quality and quantity of life. So
exactly.
This is very good. Thank you so much for coming. I didn't get to thank you earlier. Thank you for coming. I know you're busy, and I appreciate you taking the time to come chat with our viewers today.
Yes, thank you for having me.
My pleasure. So now I have people who are watching who are like, ooh, I like Dr. Brittany. I want to connect with her. I maybe want to have her come and talk to the men group about how to do this, or maybe their women's group, or a group in general. If someone wants to connect with you as a speaker or to work with you, Doc, where can people find you?
Yes, and I would love that. I am definitely open to, helping anyone wherever you are. I can, provide help or insight or, anything that's needed. So I am the Chief of Rheumatology at Summit Rheumatology in Arizona, but then I also am on Facebook at AZ Rheum, RHUM, like rheumatology doc. So AZ Rheum doc on Instagram, YouTube, and Facebook.
Awesome. And what we're going to do is we're going to post all that information here so people can connect with you after this live. But once again, thank you for coming, and thank you to our viewers for watching.
Thank you.
Yes. And for those of you who are watching, of course, we talk about this all the time. Caring is sharing. Please tag your friends, forward this to those who you know could benefit from this live. And if you or anyone you know is looking for an awesome, a thorough, a passionate family physician who helps improve quality and quantity of life, or who believes in helping her clients live long and well, I am she. Have a good one, everyone. Thank you, Doc.
Thank you.